Senator Anderson.
Madam Speaker, or Madam Chair. My first question is for Minister Blair. On behalf of my colleague, Senator Simons, representing Alberta. Minister Blair, in recent weeks we've read tragic stories from across Canada of Indigenous, Black, and South Asian Canadians who are experiencing mental health crisis and who were killed after police responded to check on them. In Edmonton, for more than a decade, the Edmonton Police Service has assigned embedded officers who are based at a mental health clinic at a downtown hospital. Each officer works full-time with a partner who is either a psychologist, a psychiatric nurse, or a social worker trained in dealing with mental illness. Together, these 8 integrated police and crisis response teams who travel in unmarked cars respond to wellness checks and mental health and addiction crisis calls and de-escalate such situations safely. They respond to 700 calls a month with few incidents of violence. More recently, Alberta Health Services has also begun partnering with 2 embedded RCMP officers from K Division in Edmonton on a similar model. Given the potential for violent and fatal outcomes when police officers alone respond to mental health calls, especially when the person involved is Indigenous or a member of a visible minority, would you consider encouraging the RCMP across the country to embrace a similar integrated response model?
Thank you very much, Senator. And I can advise you that actually in 2002, I implemented the first medical crisis intervention teams in Canada, in Toronto, and as chief we established 30 such teams, and it was a police officer and a mental health nurse working together as a team. I can tell you that produces excellent outcomes for the people that we serve that are in crisis. Unfortunately, 30 teams, and it sounds like an awful lot of people, but in Toronto, just as an example, and I only use an example because it's the one with data that I'm most familiar with, but in Toronto, they answered about 30,000 calls per year for people, what are often referred to as emotionally disturbed persons. Many of those in mental health crisis or an emotional disturbance. And those situations, overwhelmingly, and 99.9% of the time, are resolved through de-escalation and appropriate intervention. The best outcomes, of course, were with the medical crisis intervention teams. But unfortunately, some of those calls also began as a person with a knife, for example. A very dangerous situation to send non-trained personnel like the nurse into that dangerous situation. And so there are a number of different ways in which the police respond, and I acknowledge to you that some of those quite recently, and not just recently, but have also ended in tragedy. And so it is absolutely essential that the police receive the training that they need. I am in complete agreement that with the use of such integrated teams. You know, I think there's many discussions taking place around the world, certainly in North America and including in Canada, on issues of, for example, defunding the police. But I think what people are really talking about is finding alternative ways, better ways, to respond to these critical situations that the police, with all of their training and their tools, may not be the most appropriate response, but they are the only available response. And if they're the only ones at 3 o'clock in the morning to respond to such calls, they take their training and their tools and their limitations. I think through training and proper equipment and other means, we can continue to provide a safer response to these critical incidents. And I would commend to the Minister, in the aftermath of a similar tragic situation where a young man was shot to death by the police in my city, I actually contracted with then retired Supreme Court Judge Frank Iacobucci and asked him to do a very comprehensive study into how the police respond to people in crisis. He provided a remarkable report that I think identifies a number of very significant things that can and should be done. He made approximately, as I recall, 74 recommendations to the Toronto Police Service while I was the chief, and we implemented all of them. And I have shared that with the RCMP leadership in this country. I've also shared it with every other police service in Canada because I think there is value, there are lessons to be learned, and we must do better.
Mr. Blair.